So I'm here at the British Hair and Nail Society's Nail Education Conference in Cheltenham, speaking to Dr. Eckhart Haneke. And I just have a few questions for you about your very interesting talk about melanoma of the nail. So can I first of all just ask, what is melanoma?
Melanoma is a malignant tumor. When it occurs in the nail, we can call it nail melanoma. It derives from the pigment producing cells called melanocytes. And in fact, the name melanoma comes from Greek. Melanos means black, so we also call it the black skin cancer, which is the most malignant skin of all skin cancers.
Okay. And how does that appear in someone's nails, and what are the warning signs?
There are different kinds of appearance. The most common one is that it starts with a brown band running from the lunula to the free margin of the nail. Mm-hmm. This is a sign that there is a focus of pigment-producing cells in the nail root. Mm-hmm. Then, with time, when the melanoma grows, the streak becomes usually darker and wider. Okay. When the nail tends to split, in addition, this is usually a sign that the melanoma grows deeper into the nail root. Mm-hmm. And when the nail detaches from the nail bed and there is oozing under the nail, this is usually a sign of a far advanced, long-standing melanoma with a very poor prognosis.
Okay. Can this sometimes be tricky to diagnose? Sometimes you think it's something else.
Oh yes, it can be very tricky. There are different causes of nail pigmentation. Mm-hmm. The most common one is just blood due to a blow of a hammer on the nail, which we of course would remember. But when you have tight shoes and you hike, you walk a lot, you might get an unnoticed subungual bleeding, which can be difficult, especially for the lay public, to differentiate from melanin pigmentation. Okay. Then there are different other causes of true melanin pigmentation, a variety of drugs, chronic friction on shoes, and what makes the diagnosis most difficult is when the melanoma is not pigmented. And this is true for about 1/4 to 1/3 of all melanomas that mainly derive from the nail bed.
Okay. And what kind of diagnostic tools are available to a dermatologist to find out whether it's something benign or malignant?
Unfortunately, there are no blood tests.
Okay.
And the most important is just to look at it and to think of melanoma. When we see a recently developed brown streak in the nail of a person over 30 years of age, this is usually suspicious. However, in persons with dark complexion, like Africans, Indians, East Asians, nail pigmentation is very common, and then the diagnosis is much, much more difficult. However, we have the so-called ugly duckling sign when one of the brown streaks in the nail of a darkly pigmented person really stands out by its color. It's maybe jet black, and the others are just light brown. This makes the streak suspicious for melanoma.
That's very interesting. And I just had actually an extra question based on your talk. So you talked a bit about how the likelihood of melanoma of the nail in white or Caucasian people and darker skinned people. And could you just elaborate a bit?
In light-skinned people, about 1 to 2.5% of all melanomas are said to arrive from the nail. But melanoma is much, much more common in light-skinned people as compared to dark-skinned people. In dark-skinned people, about 20 to 25% of all melanomas arise from the nail unit. However, in absolute terms, so the number of nail melanomas is independent from skin type, skin color, depth of pigmentation.
So when it comes to nail melanoma,
When it comes to nail melanoma, skin color is not a risk factor.
very interesting. And just lastly, where can people go for more information if they're suspicious of the condition of their nail and they go to a GP, and they're concerned that there might be something more serious?
I
there?
think they should go to a dermatologist.
Okay.
However, even within dermatology, nail diseases are not the favorite topic of many dermatologists. But if there is someone who is able to make the diagnosis of nail melanoma, then it's the dermatologist.
Brilliant. Thank you very much.
Thank you.